If you look inside your heart,
you don't have to be afraid of what you are.
There's an answer if you reach into your soul. The sorrow that you know will melt away. And then a hero comes along
With the strength to carry on.
and you cast your fears aside.
And you know you can survive.
When you feel like hope is gone, look inside you and be strong. And you finally see the truth, that a hero lies in you. It's a long road when you face the world alone. No one reaches out a hand for you to hold. You can find love if you search within yourself.
And the emptiness you felt will disappear.
And then a hero comes along
With the strength to carry on.
and you cast your fears aside, and you know you can survive. So when you feel like hope is gone, look inside you and be strong. And you finally see the truth,
That a hero lies in you.
that he's Then a hero comes along with the strength to carry on. And you cast your fears, and you know you can survive.
So when you feel like hope
is gone, look inside you and be strong.
then you'll finally see the truth.
That a hero lies in you. That a hero lies in you. That a hero lies in you.
There are currently over 1,000 Asian people waiting for an organ transplant in the UK.
For many, their best match will come from someone with a similar ethnic background.
When you face the world alone, no one reaches out a hand for you to hold. You can find
The decision was actually Karan's decision because he had already registered to be a donor. I actually had asked him to cancel because I felt he was so young.
Unfortunately, only 3% of deceased organ donors come from an Asian background.
which means many wait years for a transplant.
and some die waiting.
Karan would definitely have been proud of us fulfilling his wishes because he truly was a giver and it's something that he wanted to do.
But the issue isn't that we don't want to donate.
It's time to change our indecision to action.
We must open the dialogue about organ donations with our families.
Leave them certain about your wishes when you die.
When they told us there's no options left.
The difficult news we had that day, 2 other people were getting phenomenal news that they've been waiting for. It is something people should talk about.
We've got the power to save lives. To be heroes.
To be heroes.
Karan helped 4 people in the precious gifts that he gave.
To be heroes.
To be heroes.
He helped 2 people directly, but you can't measure how many other people along the road who have now had conversations from knowing that he was a donor.
To be a hero.
To be heroes.
To be heroes.
To be a hero.
To be heroes.
Ladies and gentlemen, thank you so much for coming today to our 7th Jane Health Initiative update. Today is about COVID, vaccines and variants. And before we begin, we'll just start with a small Nokar mantra. Thank you so much. Om Namo Arihantaram. Om Namo Sitharam. Om Namo Ayaryaram. Om Namo Ujayaram. Namo Loe Savasahoram. Eso Panch Pava Panasano Mangalancha Savesim Paramam Havai Mangalam. Om Namo Arihantaram. 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 Thank you, Varsha, for helping me with the Nokar mantra. Folks, today we've got a really nice group of people who are experts in their field, and they're all going to share with us their expertise in COVID update. And this is really about making sure we don't turn our back on COVID. And so before I go on to a short reminder about COVID, I'm just going to introduce you to the colleagues that are going to come with me. So first of all, after me will be Raj Mehta, a senior cancer scientist who's now helping biotech companies looking at the immune system to find new therapies for cancer. After that, we're going to go to Dr. Anuja Shah, a really senior GP in Luton, who specializes not only in women's health, reproductive health, but also palliative care. And she's one of the most conscientious GPs I've ever met. After that, we're going to move into A&E medicine. We're going to go to North London, where my good friend Dr. Rimal Shah is a consultant in emergency medicine, and he's going to tell us all about what's going on in the hospitals in the A&E setting. He's also a medical director for advanced life-saving courses, and he's very experienced, not only with emergency care, but he's also helping virtually to India quite a lot. After that, we're going to go on to surgery with Mr. Abhay Chopada, who's a very well-known surgeon in North London. He's a colorectal and general surgeon, an educator, a researcher, and he's also a great humanitarian. He's done a tremendous amount of work for many organizations that help both here and there, and he's also an entrepreneur, and he's gone into technology companies to develop new communication technologies. After that, we're going to come to my good friend, Dr. Rajvi Punathar, who works at the prestigious Francis Crick Clinic as a principal research scientist. And she's going to discuss the myths. And her specialty is not only that she's extremely well known in the Gujarati community as a singer, but she's also one of the founders of our children's charity Sansar. And so she's going to communicate really importantly about how we should and should not communicate with WhatsApp and technologies. Finally, I'm going to be joined by Amisha, member of our panel, but a really up-and-coming star. She's a GP, but also works in A&E in UCL, the University College London, and she's learning not only emergency medicine, but she is teaching and she communicates both on ethics, law, and recently on medical technologies and becoming an innovator herself. So this is the panel that's going to join me today. So before I hand over and introduce my colleagues, we're just going to take a quick few minutes to go into COVID and the history of COVID. So you'll remember that COVID itself, COVID-19 virus, is one of the smallest life forms that can even infect not only humans, but it can infect bacteria. So viruses are small enough that they can infect bacteria. Now, viruses only have one job, which is to photocopy themselves and to replicate. And they do that not by carrying a whole load of manufacturing tools, but they infect a particular human being or a cell or any type of life form, and then they'll use whatever they find inside your cells to create more copies of themselves. So the virus's job is to find a host, to attach, to get inside that host cell, use the machinery and photocopy itself, and then repackage itself and go and infect other people by getting out of that cell and reaching others. So it comes into your house, it uses all your resources, it creates more viruses, and then sends those viruses outside the house to go into other people's houses. So just bear that in mind. It's a photocopier. It's one of the most incredible parasitic photocopiers on the planet. But its job is not to kill you or to damage the house so that you cannot make more replicants of the virus. Its job is to co-create with you and keep you alive. And the problem is that we sometimes overreact to the virus, and that is when the damage occurs, when we're not able to get over that insult of that guest that is an unwanted guest inside our body. And by overreacting, we can do damage to our lungs, we can do damage to the systems that the virus is actually hosting in and not be able to get those cells back online. This is an example on the left-hand side. It's just a simple diagram that you can see the actual cell is moving in and out. And as you look towards the bottom of the left-hand side diagram, you see this yellow fluid building up. And that's our response to the virus, our cells trying to wage war against the virus and then spilling over with fluid. As it does that, we accidentally actually have lots of edema or fluid building up inside our lungs that stop us being able to move oxygen and carbon dioxide. And on the right-hand side, on the top side, you can see the lungs that have got these clouded shadows where those arrows are in the top parts of the lungs. In the middle is the heart itself, but either side are fluffy white shadows. In the bottom right picture is the same lung that's recovered from the virus just a month later. It's the same person, and you've cleaned up those dark air spaces either side of the heart. And that's what it's meant to be like. You're meant to be able to recover from the virus. What happens is if you are immunocompromised, if you're elderly, if you have diabetes, if you have cancer or any cancer treatments, if you're prone to heart disease, you've got a weakened heart already or weakened lungs, if you're overweight, if you have kidney disease, any of these conditions on the left-hand side can make you prone to overreacting. So those are the patients or people at risk of not being able to get over the virus. Let's have a very quick look at exactly how many people are harmed by the virus permanently or persistently. At the moment, you'll see on the bottom side in the middle, there's that mild to moderate illness. 4 out of 5 people within 8 days will overcome the virus and only be left with another 6 or 7 days of fatigue. So within 2 weeks, 4 out of 5 people will be able to get over the virus without requiring any hospital admission. 1 in 5 people will require the support of hospital. Of the people who come into hospital, 3/4 may or may not require oxygen support, but will happily get through the virus with the support of oxygen and help from steroids, etc. Only 1 in 20 people who get infected require a ventilator, and less than 1 in 50 people are currently not making it through COVID pneumonia. The overall statistics are that we've currently lost measured population of 3.5 million have passed away out of 166.3 million people confirmed to have COVID pneumonia. And that percentage, 2%, 1 in 50 people passing away with COVID confirmed, has been stable for some months. So 49 out of 50 people will make it through COVID. Of those 50 people, only 10 people will require the support of hospital care. The way we recover faster, this is an example of how in the UK we undertake clinical trials where we look at many medications to see if they'll get you out of ITU quicker, if you'll survive quicker, if you'll get you off oxygen quicker, and stop you needing dialysis if your kidneys are damaged by COVID. We've looked at many medications. We've looked at HIV medications, so antiretroviral medications. We've looked at steroids. Dexamethasone is an example. We've looked at medications that prevent gout and inflammation in your body. We've also looked at anti-cancer drugs. So all of these sorts of therapies we've looked at really carefully. And of all of them, we've only found that steroids are the ones that particularly help. But they don't help everybody. They help people who require ventilation and who require oxygen. If you do not require oxygen, you've seen no benefit from steroids, and there may even be a small signal that actually steroids do harm. And we're now seeing that being given steroids unnecessarily, as well as antibacterial agents or antibiotics, can cause fungal infections to come up in your body and harm you after you've recovered from COVID. So unnecessary use of steroids may actually potentially be harmful. And so these trials are the way we do an evaluation of the medications against people who've had standard of care. And then each of these medications looked at very carefully by regulators and clinical trial experts and researchers. In the UK setting, we've got through 2 waves. The first through lockdown measures, the second through lockdown and having bought time to get vaccines. But this is just one component of what helps us get through COVID-19 in the UK. The most important part is collaboration and good communication at all times. You can see here a number of groups of people who've helped. The media have helped. They've said, be calm, be safe, actually keep away from things, don't travel unnecessarily. The government has given really clear guidelines. When vaccines came along, so many people volunteered. The science that has allowed us to create vaccines that in the fastest possible time, we've undertaken these trials and brought these products into the market in a safe way. The rollouts that we're doing and monitoring of any vaccine-related side effects, we'll talk with Rimal shortly after that, and Raj will tell us about the different types of vaccines. We'll see that the collaboration between scientists, researchers, the public who've come forward to say, we'll take part in the trials, this has been unprecedented. And it's because we have the support of pharma companies, the support of government, the support of the Treasury to help us with economic issues, that we've been able to navigate this slowly and crawling through bit by bit by bit, reducing, we call it flattening the curve, stopping people spreading, stopping people being vulnerable, and allowing our healthcare resources to safely cope with the number of people who do need to come into hospital. And that has been the most important. Communication has gained us confidence to be able to cope. So the final aspect that I wanted to say is that we are, as Jains, importantly, always thinking about the right faith, the right knowledge, and the right conduct. Within COVID-19, that means being informed, being prepared, and continuing to be protected. Avoid the third wave in the UK, avoid any waves anywhere else, don't spread COVID, don't turn your back on COVID, even if you've been vaccinated. You are still at risk of getting COVID, you're still at risk of getting long COVID, but much less likely to need hospitalization, much less likely to have death. And so it's really important that whatever happens, even when we're coming back out, we're unlocking down, we're allowing ourselves to be able to travel, get back to work, get back to meeting people. Please be calm. Please be aware. Please be safe. If you're seeing yourself getting any temperatures or any signs of a dry cough, any new aspects, please keep yourself being tested and actually look at the isolation procedures. Don't spread COVID unnecessarily. And in the aftermath, yes, we may have got over COVID, but remember, for the last 18 months, we've not managed cancers properly. We've not managed lung and heart disease. So please make sure that if you're seeing any of those sorts of signs, if you're getting depression, if you're getting any symptoms of long COVID, please seek help. And Anuja will help us understand those aspects. So communication, calmness, confidence, and please help us get through COVID. Don't turn your back. I'm now going to hand it over to my good friend Raj Mehta to bring him on board. He's going to tell us about vaccines. He's going to explain to us about variants of the virus. And after that, we're going to understand what we need to do on that side and perhaps any new therapies. Thank you so much, Raj. So Raj, if you could just unmute yourself, that'll be really cool. Thank you. And just unmute one more time, Raj.
Good evening,
Perfect.
all.
Brilliant.
I wanted to talk to you about variants and vaccines. So first of all, what do we mean by variants? So we've heard about lots of variants along our journey on COVID-19, the Kent variant, the South African, the Brazilian, and recently the most worrying, the Indian variant. What are variants? So variants are essentially changed version of the virus that has gained some advantage. All viruses create variants. COVID-19 is not unusual. In fact, actually, COVID-19 creates far less variants. It changes far less than actually some of the other viruses we know. So it's not unusual. But when a virus enters our body, as Ameet explained, it creates lots of copies of itself and goes and affects other people. In the process of creating that lots of copies, it makes some mistakes. And those mistakes sometimes give them an advantage. And that advantage, if it gains an advantage, it then follows through into the population, and that's what we know as variant. Some of the advantage that we do know that some variants are getting, for example, are they're more transmissible. That means they're better at infecting people, which means they're easier to catch. Some variants are also lessening the effect of the vaccine. That means that we are less protected from the vaccine. Now note, I say less protected. That doesn't mean we're not protected. So that's an important lesson to take away from today, that all the vaccines seem to be working more or less against all the variants. When people hear that vaccine is not working, that is not true. They do work. They may work less. The other thing to bear in mind is, as I mentioned, the variants are created because of replication in ourselves, multiplying in ourselves. So the less there is virus circulation in population, the less chances there are variants to arise. So if we prevent virus from infecting ourselves, you're not just protecting yourself, but you're also protecting the community because you're lessening the chances of new variants developing. Now, we've heard about many variants, we've heard about many vaccines. In fact, 3 of them are approved in UK. The first message I want everybody to understand is that some vaccines seem to be protect us to the lesser extent against some of the variants. Now, the picture is complicated against different vaccines against different variants. However, just bear in mind, none of the vaccines are 100% effective, right? And when we say that when you're fully protected with the virus, that means when you had the 2 doses and 14 days after the last dose. Unfortunately, as we said, none of the vaccines are 100% effective. So even if you're fully protected, there is a small chance, and certainly a lot smaller chance than if you're not vaccinated, but there's a small chance that you will get infected COVID-19. And this is what we call breakthrough infection, i.e. when people are fully vaccinated, they still get infected. However, what is really clear is actually, even if you do get infected post-vaccination, you seem to be protected very well against serious disease or hospitalization. So all the vaccines seem to be highly effective at preventing serious disease and also protecting against getting the infection in the first place. Now, one of the things that's come up very rapid in the last few weeks is the India variant, and it's been causing a lot of concern amongst all of us, and it's a huge, huge problem in India. What is the India variant? It's essentially a changed version of the virus that's originated in India. We don't know too much about it yet. It's just early days. There's a lot of research being carried out. But what we do know is that the current data seem to show that it's more transmissible than the original COVID-19 virus, up to 50% better at infecting people. What does that mean? That means if, for example, the original COVID-19 virus, if one person had it, he can give it to 5 people. It seems that the Indian variant can give it to more than 5 people, 7 or 8 people. So it spreads faster in a community where there are less people being vaccinated. The good news, though, is that it doesn't seem to pose a greater danger, i.e., if you do get infected with the Indian variant, it doesn't necessarily make you iller. So remember the statistics that Ameet talked about, 85% of people get well by themselves. They don't need hospitalization. It seems to be true, same with the Indian variant. And for us in UK, especially for those of us who have been vaccinated, the other good news is all the vaccine approved in UK seem to be protective towards Indian variant. There isn't a loss of protection against the Indian variant. So that's really good news. So if you have not been vaccinated and you are eligible for vaccination, as always, please get vaccinated as soon as possible. Let's look a little bit towards the future, what's coming down the pipe in terms of the COVID vaccine and COVID-19 infections. I would not be surprised if more variants arise. It's just some things that the viruses do, which makes it very important we keep the infection rates down. As I mentioned, the more infected people, the more chances of variants arising. So if we keep it down, we'll keep the number of variants down. There's a tremendous amount of research being carried out. There's a huge amount of research in prevention, how to prevent COVID-19 infection, how to treat people who get the infection and get really ill. And also a lot of now research into what we're calling long COVID, which Anuja will be talking about. There are second generation vaccines already being prepared and under development. These are the ones which are designed to protect you against the variants. And they may be given as booster shots down the line if the population needs it. On top of the actual vaccines, which are designed to protect us from getting infected, there are a number of treatments being developed now, which is treating people who do get infected. Now, as Ameet mentioned, there is a small proportion of population that if you get infected, you end up in hospital for various reasons. But this is where you can expect to be given these new drugs in the future. So Merck's developing a drug called molnupiravir. Japanese firms are developing another similar drug, favipiravir. Pfizer, Novartis, other pharmaceutical companies are developing COVID-19 drugs. But what is really interesting is the companies are now looking even further than COVID-19. So they're trying to develop drugs which are going to be suitable for treatment of COVID-19, but also other coronavirus pandemics that may arise in the future. So we're actually future-proofing ourselves and just not focusing on COVID-19 itself. I'm going to leave it there. The key messages I wanted to give you guys is the vaccines are effective even against various variants. Keep vigilant, continue safe practices. Ameet said, it's still the time. This is not the time to turn back on the virus. Social distancing, masks, washing hands, etc. Please keep them on. Keep them doing that even if you're being vaccinated. The Indian variant is very worrying, at least what we've seen in India. However, and it seems more infectious. However, the vaccines, at least the ones that have been approved in UK, seem to be working. And improved vaccines and treatments are on the horizon, so we should be seeing more news on those in the coming months. Thank you, and I'm going to hand it back to Ameet.
Raj, thank you so much. And your clear scientific knowledge is really showing through. Don't go away because we'll have a lot of question and answers after the speakers have spoken. I'm going to move over to Anuja. So if you could stop sharing, Raj. Anuja, we've mentioned long COVID. Tell us what's happening in primary care about long COVID. Tell us about women with pregnancy. Should they be having vaccines, etc.? And any other advice you want to give us. Thank you, Anuja.
Thank you so much, Amit. So, Jai Shrindra, everyone. And today I'll be talking about long COVID. Let me put it on presentation mode. Thank you.
Yep, we can see your slides, Anuja. Perfect.
So after the first wave of COVID, many patients consulted me with unexplained symptoms. These symptoms lasted for over 4 weeks, and sometimes they were persistent beyond 12 weeks and ongoing for several months. Often these were white women, often previously perfectly fit and healthy, and only had had mild COVID. Some of my hospital colleagues were also suffering in a similar way, and they were unable to resume work. Seemed like a giant puzzle. We now recognize this as long COVID. Now we have some guidelines, thankfully, from NICE and the Royal College of GPs to help us. 1 in 5 people who suffer from COVID can end up having long COVID. It's thought to be due to an exaggerated immune response. Our immune system helps mend our tissues, but when this mending process does not stop, we can get into trouble. So what are the common symptoms? Patients present with multiple complex symptoms which fluctuate, getting better and then worse the following day. Mild exertion can make the symptoms worse. As shown in this figure, the common symptoms that the patients complain about are fatigue and breathlessness. Even simple tasks, such as climbing stairs, can be a struggle. This, combined with brain fog, which is lack of concentration, memory problems, feeling that they cannot think clearly, makes it very difficult for them to resume work. Other symptoms such as joint pains, muscle pains, chest pain, cough, diarrhea, all of this can be very challenging. Although COVID mainly affects the lungs, it can affect other organs such as the heart, the kidney, the guts, making it a multi-system disorder. There are many more symptoms that the patients have reported, and this list is not exhaustive. So, how can your GP help you? First and foremost, the GP needs to listen, be sympathetic towards you, and explore your concerns. They will also take a good history and find out how it's impacting your life. They will also want to arrange further investigation, such as blood test, a chest X-ray, etc., to rule out other causes for the symptoms, such as scarring of the lungs or blood clots in the lungs. They can also give you advice on how to manage your symptoms at home and refer you to a specialist rehabilitation center if needed. These are called long COVID centers. So, how can you help yourself? Have a healthy lifestyle, get plenty of rest, ensure that you get enough sleep, have a healthy diet with plenty of fresh fruits, vegetables, nuts and beans, whole grains, reduce alcohol intake and smoking. Ensure that your vitamin D levels are optimum. In a population where vitamin D deficiency is common, it may be a good idea to take vitamin D according to the government guidelines. Pace yourself and don't overexert yourself. Plan and prioritize your activities. Take short breaks in between. It is better to do your activity in short bursts. Avoid boom and bust cycle. Have a daily routine. Boost your mood. Avoid stress. Think positive. Practice mindfulness. Listen to music. Anything that makes you happy. Connect with your friends and family. What support can one get? As mentioned earlier, speak to your GP who can refer you to one of the many long COVID clinics rolled out across England. These are multidisciplinary clinics run by doctors, physiotherapists, occupational therapists, and psychologists, and aim to give a holistic approach to treating the patient. Your COVID recovery website has some excellent information for patients. Your GP can also refer you to a physiotherapist or a psychotherapist, psychologist, and offer you support such as cognitive behavioral therapy. Many patients have not been able to resume work and have suffered financially. Your GP can refer you to the social prescriber for support with housing, employment, etc. A few words on the vaccines and COVID-19. So, should patients suffering from long COVID have the COVID vaccine? Yes, definitely. Anyone who has had COVID can have their COVID vaccine 28 days after their symptoms started or 28 days after a positive test. The vaccine is not linked to long COVID. In fact, there is some anecdotal evidence that the mRNA vaccines, which is the Pfizer and the Moderna vaccines, even help with the symptoms. Also, the mRNA vaccines have now been approved by the Joint Committee of Vaccines and Immunization to be used in pregnancy. There has been no safety concerns in about 90,000 pregnant women who have had these vaccines in the United States. Pregnant women can have the vaccine at the same time as the rest of the population according to their age and clinical risk groups. It can be given at any stage of the pregnancy, and it can prevent severe infection with COVID during pregnancy, which can also cause premature birth in a pregnant woman. So these are some of the resources available, and this list will be available on the One Jane website. As we come out of lockdown, let us take the next steps with utmost care so as not to overwhelm our NHS and the staff who have worked tirelessly in the last 2 waves without taking holidays just to serve us. So ensure that we don't go partying and make sure, as Raj said, wash hands, wear masks, keep social distance. As we come out of lockdown, those suffering from long COVID are still in their bedrooms. They need us to support them and believe in them. New research about long COVID will help us solve this puzzle. There's lots of research already ongoing. The REACT study, post-hospitalization, POSH study, and HEAL COVID are some of the studies that have been ongoing. Thank you for listening. Back to you, Amit.
Anuja, thank you so much. That was such a good exposition about long COVID, as we know that anybody can get long COVID at whatever age you are as an adult, and even some youngsters. And it's those ongoing symptoms. And it's lovely to see that there's both research and an understanding of that area. And hopefully we'll be able to tackle that in the future, just as we've tackled COVID now, we'll also need to tackle long COVID. I'm going to move over to accident and emergency, the hospital front door. I'm going to introduce Rimal. Rimal, tell us what's happening in A&Es at the moment. What sort of things are you seeing coming in? Are we still seeing COVID coming in, or are there other things coming in?
Thank you, Amit, and Jay Jinendra, everyone. So yes, after February, March, when the COVID surge settled down, A&E started getting extremely busy. Up and down the country, we're seeing unprecedented demand of patients, predominantly non-COVID. For a combination of reasons, and that's replicated across the NHS. It's not just A&E departments, it's primary care and secondary care together. We're seeing a combination of mental health illnesses, we're seeing a combination of cardiovascular and respiratory conditions, combination of patients who are having complications from long waiting lists, who may not have had the confidence to present earlier, and obviously there are people who have obviously had a very hard time mentally throughout lockdown, through job losses, or generally just found lockdown so difficult, exacerbation of their mental health problems as well.
And are those patients converting to admissions to hospital as they did with COVID, or is there a difference in that setting?
So no, the numbers have gone up of attenders, so for average by about 20% on some the last few weeks actually, but at the moment we're not seeing a massive rise in a conversion into admissions, suggesting that most patients can be investigated and discharged home.
That's very reassuring, Rimal. Rimal, we've seen some adverse effects with vaccines. You and I have spoken about vaccine-related clots. Can you tell us a little bit more about that?
Yes, so the vaccine in question here is the Oxford AstraZeneca vaccine. And back in March, we started seeing a signal that there was an association between this vaccine and possibly a sort of very rare type of clot with bleeding. I'd like to say before we talk a little bit about this, that the AstraZeneca vaccine is a highly effective vaccine that prevents hospitalizations and death, and that what we're talking about is an extremely rare side effect that we just need to be aware of. And we started seeing some patients presenting to us essentially with side effects, predominantly because of the media attention that was put onto this, and rightly so. So what we're really interested in looking at is patients who've had the vaccine but have the following symptoms between 4 days and 4 weeks, essentially. So that's separate to the vaccine side effects that you get for the first 24 to 48 hours, essentially, which is just a sore arm and some flu-like symptoms and a mild headache. But if your symptoms are there after 4 days, and particularly around up to 10 days, we would want you to seek medical attention. And sorry.
No, I was just going to say, so any new headaches, any new breathlessness, any new swollen arms or legs, or any new stomach pains after day 4, is that the ones we're worried about?
Those are the ones we're worried about, and also any abnormal bruising or bleeding.
Fantastic. And are they good blood tests that can tell us if you're suffering from a vaccine-related clot?
Yes, so a very simple blood test that can be done in the emergency department is a full blood count where we're looking at a particular blood cell called platelets. What we have found is that with the condition that we're talking about, the platelet counts drops to a low level. So that simple blood test will allow us to sort of essentially at this moment in time rule it out and look at other causes for the symptoms.
Fantastic. Rimal, are A&Es safe? If you don't have COVID, do you still need to worry about catching COVID from anybody in the waiting room? Is there any issues like that?
It's a good question, Amit. A lot of effort has gone into different areas of the NHS in order to protect patients and to protect staff. Obviously, nothing is 100% foolproof, but a lot of, so the moment you come into the emergency department, you may not even be allowed in if you're accompanying someone. We're only allowing patients in there with a few exceptions. You'll be asked to wear a mask, you'd have your temperature checked, and there is social distancing in the waiting room. Once you proceed into the department, we have high risk areas and low risk areas, essentially based on your symptoms, therefore reducing the risk of you sort of being next to somebody with potential COVID. And then if you're going to then be admitted to the hospital, you would have a swab, and obviously the wards are segregated as well, so that the high-risk patients are not mixing with low-risk patients. So a lot of effort goes into trying to protect patients and staff.
And our systems are really very carefully measuring whether anyone is getting hospital-acquired infections. You know, in the old days, we were measuring MRSA, we were measuring Clostridium difficile, so bugs that could give you diarrhea. And of course, we're monitoring if anyone accidentally catches COVID, becomes positive after they've arrived in hospital, being negative in the beginning. So we've got a lot of surveillance and scrutiny regularly. So we're tracking that. Any last piece of advice you'd want to give for our friends and family in India at all, Rimal?
To friends and family in India, our thoughts and prayers are with you all. But essentially, the golden message essentially is that don't panic, stay positive, don't try to acquire medicines that don't work. Seek medical attention and follow your doctor's advice. If you've got simple COVID at home, the same instructions as for our public here. It's hands, face, space. So wash your hands, wear a mask, social distance, and make sure you've got a pulse oximeter at home.
Thank you so much, Rimal. That's been really helpful. So we've gone from primary care, we've gone into A&E, and now we're going to go over to surgery. I'm going to invite Abhay Chopada. So it's Mr. Abhay Chopada because you're a surgeon, but of course you're a doctor and a surgeon. Abhay, thank you so much for coming. Abhay, can I ask you, what's been the impact of COVID on surgery in the UK?
Thank you so much, Ameet. So surgery was one of the first areas that got disrupted in the first wave. And the reason for that was twofold. We actually had a lot of surgeons falling ill because they were directly getting exposed to the patient for prolonged periods. And at that point, we were just at the beginning of the pandemic, which meant that we literally had to stop all surgery. And the second reason for that was lack of ventilated beds. So immediately all our ventilators which were available in theaters were repurposed to create extra ITU support and ventilated beds in the hospital. So during the first wave, we practically stopped operating. And the only operating that was happening at that point was life-saving surgery. We had commanded the entire private sector to be able to do some elective stuff. And unfortunately, that didn't work because of the huge codependencies that we have in an NHS setup. We were far smarter during the second wave. By the second wave, we had already learned our lessons. We had PPEs in place, we had segregated areas, we knew how to protect our surgeons, anesthetists, and the patients. So we have managed to keep especially emergency and life-saving surgery going throughout the second wave without a disruption. However, surgery is a volume phenomenon. And what we previously used to manage in a whole day, and now we obviously have to cut it to 50%, given that you cannot admit patients close to each other, you cannot operate till you've cleared the theater. So we're looking at a huge waiting list. The waiting list is not applicable to people who have time-sensitive surgery. In other words, the cancer cases, the life-threatening stuff, people whose long-term disability will get worsened, those cases we're definitely giving priority to. But low-priority surgery, especially like inguinal hernias, varicose veins, there are no low priority now. Unfortunately, given we are a public health system, I see a foreseeable delay for those cases to get addressed. However, we are increasing capacity. So majority of the hospitals are now operating 3 shifts instead of 2. So we're expecting to add capacity, and we'll just have to wait and see how we manage the scenario.
That is a lovely answer, Abhay. Thank you so much. I know you're doing a huge amount of work with helping colleagues in India. You're helping surgeons, you're helping doctors, you've really turned your hand as always an innovation. What sort of things can we do? What sort of advice are we giving to help our friends, family and our colleagues in India?
So, first of all, thank you so much for asking about India. My heart is still there, and I'm sure all of our hearts are in India. But when I compared ourselves with India, there was one clear thing that I really felt we all should address. In UK, we had a very, very clear line of communication. I still remember every day religiously at 5 o'clock, I used to turn on the BBC. We had our Prime Minister addressing us along with the Chief Medical Officer. Very clear guidance. And there was no question of doubting anyone. We knew that information we will get will be absolutely validated information. When I look at India today, it is more about panic due to the single thing, lack of communication. People have depended on the WhatsApp university. People are stocking up on things that they were never going to use or need, like remdesivir, like oxygen cylinders. And remember, it is a panic that is killing far more people in India than our health infrastructure. Indian healthcare also had one big flaw, that we were very, very focused on direct care, but not on the public health. Now, when you ask me, what do I want to do today? Today, obviously, we are trying to gain as many resources to send back to India. We've collected equipment of more than a few £1 million and sent it to India. But the bigger thing I'm very keen is collaboration. You mentioned at the beginning, the two factors, communication and collaboration. And I must insist on this one fact that we are here to support our colleagues and our families in India. We've started a buddy system with BAPIO. So what we are doing is we are actually helping the doctors in India to say, hey, you are not unsupported. You can reach out to us. We actually can help you. We can give you advice. And we are doing this within the constraints of what the law allows us to do.
Perfect. That confidence that you're imparting is so important for people to know that, you know, you've been through this, you're going through this, you understand what they feel. That's so nice. And within that communication, you've also innovated in the idea of telemedicine. You've also innovated in that collaboration. Tell us what you've done and why you're doing it.
Ahmed, actually, I started my telemedicine idea a lot earlier than the pandemic. In fact, the pandemic really validated my idea. I had always believed that healthcare is no different than data transfer. You and me as a doctor, we basically essentially interpret data all the time. That data could be coming from patient's history, from devices, patient's assessment. And so I was more keen to look at telemedicine beyond video calls. A lot of people thought just having a video call showing a few documents is enough. That's dangerous because we actually know that if incomplete information, that can harm a lot of patients. So luckily my platform was ready. I've already started implementing it. But what we are essentially doing is doing a complete remote consult using a technology platform to the extent that you actually can do someone's pulse oximetry at home and look at the display live without asking the patient. Or you can listen to someone's chest at home sitting in UK. This is all possible. Of course, this is an evolving area. But I absolutely know that technology can help us both in a positive and a negative way. When I talk about telemedicine, I'm very keen that doctors start talking with each other and address the caveats or the dangers in a collaborative fashion. But definitely technology has a role to play because as we go ahead and if there's a new pandemic, we won't have choices.
So it used to be Doctors Without Borders. Now I can see it's Surgeons Without Borders. And basically it's healthcare professionals without borders, and thanks to the telemedicine innovations. And you've mentioned that communications can go wrong. So I'm going to move over to Rajvi Panatha next. So thank you so much for that, Abhay.
Thank you.
Rajvi, I'm bringing you on board. Communications can harm. Communications can go wrong. You and I started doing this work, really important to get the vaccine update as high as possible. And Harrow happens to be the highest uptake, probably because of the myth-busting work that you've done. Tell us about the myths, tell us about what's going on, and tell us about the reassurance we should be giving. Thank you.
Thank you so much, Ameet and Janendra, everyone. I'm just going to share my screen. So I have some slides to show you. And yes, Ameet is right there. I'm very passionate about the counteracting the myths and misinformation that is spreading out there. So how does this happen? Well, we have social media and we love it. And during the pandemic, it has been a lifesaver. It's enabled us to stay in touch with our loved ones, whether they're here in the UK or abroad. But the problem is that it's also a place where a lot of misinformation can be spread, and it spreads like wildfire. And in places like Facebook or Twitter, there can be some sort of moderation from the platforms. They can keep an eye out for false information. But one of the places where this cannot happen because of end-to-end encryption is WhatsApp. And in fact, in India, there are 500 million WhatsApp users. And many of us are in WhatsApp family groups that span multiple continents, from here to India to the USA. And right now, because of what is happening in India, there is also a lot of myths and misinformation and fake news spreading, which then comes from India, it comes here, we pass hours back there, and it just moves around the globe. And this is causing a real problem, because what it does is all these conspiracy theories, they cause uncertainty and anxiety, and they actually make people think about whether they should take their vaccines or not. And right now, we don't have a cure for COVID. What we can try and do is help our own bodies fight it, and that is the way we do it, is by vaccines. So what do some of these myths and misinformation at the moment? I mean, about 6 months ago, I told you about all the ones flying around then. So what are the latest ones? Well, many of these are coming out of India right now. So the cow is very revered. And there are people that believe that drinking cow urine or smearing your bodies with cow dung will somehow protect you from getting COVID. Now, I don't know about you, but I'm sure that smearing yourself with the cow dung will certainly help the social distancing. I can't imagine anyone wanted to get close to you. However, there are pathogens in these things. The other thing is people say having garlic, cinnamon, or licorice can prevent COVID, or drinking hot water with lemon can stop you getting infected. Inhalation of steam is another very common one. And this next one is very dangerous: the use of nebulizers in place of medical oxygen tanks. Now, we know there's a shortage of these tanks, but nebulizers cannot deliver oxygen into your lungs. What we do know about all of these sort of fake news and misinformation that's spreading is none of these practices have been shown to either prevent or cure COVID-19. Yes, they may help ease the symptoms. They may make you feel temporarily a little bit better, but they are not a cure. So what I would say is, if anyone sends you these on your groups, please don't forward or share these videos and messages. The other thing that's coming out of India right now, a lot of emphasis on herbal remedies. And there's one particular one that has been being sold. It's called Coronil. It's been sold by a company by Baba Ramdev. He's one of his manufacturing companies. The claim is it's an oxygen enhancer and that it cures COVID and is certified by the World Health Organization. Now, this is completely false. And in fact, the WHO had to come out and make a statement that the use of untested products to treat COVID could actually put people in danger, because by taking them, they may have a false sense of security, and then it will stop them from doing the things that really do help, like hand washing, like physical distancing, and like taking your vaccines. The Indian Medical Association, the IMA, is the equivalent of the BMA here, has criticized high-profile figures. So these may be politicians or religious leaders, people who are celebrities, for promoting unproven treatments. And again, they're saying it's unethical and undermines the need for things like vaccines. There are other videos that are also being spread. Many of them are made by anti-vaccine campaigners. So here is one that was reported on the BBC website just last week, Biswarup Roy Chowdhury. He's a very charismatic person. He has many followers, but what does he say? He rejects the use of modern medicine and vaccines. He rejects the use of face masks. He says they don't help. He claims he can cure COVID-19 through diet alone. Again, I just say to everyone, please, if you receive something like this, don't forward it. There have been a lot of rumours about the effect of vaccines on fertility, and that was over here in the UK. It's also happening all around the world. And these myths were saying that for some reason vaccines affect a woman's fertility. And in fact, this is false. The Association of Reproductive and Clinical Scientists and the British Fertility Society have put out this statement that there is absolutely no evidence and no theoretical reason that any of the vaccines can affect the fertility of men or women. There are also articles from conspiracy websites. Here is one that I actually received on my WhatsApp, and it looks very convincing because it sounds like it's a study that's been done by scientists. Actually, it is nothing of the sort. It's coming from a conspiracy website, and right at the end of this article, which has no data at all, says, note to readers, please link the share buttons above or below, forward this article to your email list. I can tell you categorically as a scientist that no scientist worth their salt would ever write something like this, and you would never see this on any bona fide scientific article, that you have to share this message through your social media. So this is the latest one that I was just drawn attention to today on the BBC website. This has got millions of views on TikTok and Instagram. And it's showing, or it's purporting to show, that people are holding magnets to the arm where they've had the COVID vaccination and saying, oh, look, it's sticking. There's something magnetic inside the vaccine. This is also completely false. Again, if you see anything like this, please don't forward or share it. So now for my last two slides, I want to share with you what advice I give to people to how to spot fake news. First of all, does it sound believable? Does it sound a bit crazy? If it does, it probably is fake news. The other thing, has the story been reported anywhere else? For example, is the first time you hear of such a thing on your social media? If it is, if it's not reported anywhere on the BBC or on CNN or any of the reputable broadsheet papers, then again, alarm bells should be ringing in your head. What is the source? So whenever you get a message, is there a website link? Is there a name of someone who's saying these things? Again, if there is no name, if there is no link, then do not trust it. And finally, please, before you do anything, and if you're not sure about it, show it to someone you trust, a doctor or a pharmacist or someone who has got a scientific background. We all have them in our families. We all know them. So please, before you do anything, if in doubt, do not share or forward. And finally, I have a message for anyone who is an admin of a WhatsApp group. We also have a responsibility. Adopt a strict no forwards, no fake news policy. And secondly, do call out people for posting misinformation. I know in the past it was uncomfortable and you think, I'll just ignore it. I'm sure everyone won't believe this. But the point about this is, if we allow this sort of misinformation to occur, it's actually dangerous. So by doing all these things that I'm suggesting to you, you may actually save lives. So Ameet, that's the end of my session. I will stop sharing now and hand back over to you. Thank you very much for your attention.
Rajvi, that was such a nice way of telling us to have the right faith, the right knowledge, and the right conduct. That was ideal Jain principles of making sure that even when we communicate, we don't do any harm. Thank you so much. Folks, this is the end of our sessions where we knew what information we wanted to give you. It's really important now that I ask one favor of all of you. It's really important. Please undertake the survey at the end of this session. Please give us a couple of minutes to tell us, the 20 to 30 professionals that we've got, what should we be bringing to you as the next topics? We've got another talk in 3 weeks' time on cancer. We've spoken about diabetes previously. Hi, Amisha. Nice to see you. I'll bring you in just in a second. We've talked about COVID updates. We've talked about falls. You know, what are the things that will help you? What are the things that you want to know about? What are the things you want to be prepared for and be protected from? And so that's really important. Your opinion counts. Tell us what you want us to bring. Tell us why you're interested. Have we made a difference? If we can understand that our messages are helping people, if we can show that and document that, that gives us evidence as well that we are making a difference, and we can get grants. We can do more things. We can put on health checks for you. We can actually tell you about cholesterol technologies. We can tell you about research, how to participate in research. We can tell you how to access the NHS to get the best out of your relationship with your GP, your pharmacist, your physiotherapies, etc. On that note, relationships with GPs, Amisha, how are we doing with Q&A? How are we doing with the chat? And where would you like to take us?
Good evening, and Jay Janendra. Thank you, Ameet Bhai, and thank you to all our expert panelists. We have a number of questions coming through, so let's get stuck in. And please, to the public, please continue to add your questions in the YouTube chat, and our panelists who are all joining us will be happy to answer. So I'm going to crack on.
Just before you do that, I'll just get Anuja back online. Anuja, please join us. And Raj as well. Thank you. We're all online. Amisha, go ahead.
So I'm going to start with Rimal Bhai. Someone has had AstraZeneca vaccine as a first dose. What vaccine should be taken as the second dose? Can they have the same, or can they have another one?
Thank you, Amisha. Very good question. At the moment, the JCVI suggests that the same vaccine should be given as a second dose to the first dose, unless there's been some complication from the first dose. There are ongoing studies in the UK at the moment about mixing vaccines, but we're still awaiting the trials.
Perfect, thank you. And Ameet Bhai, how many types of COVID tests are there? Why is there such a significant variation in the cost of the various ones out there? And are COVID tests required for traveling?
Yeah, that's a great question, and I'll get Raj also to help me here. There are different types of tests. There are lateral flow tests, which are really rapid, can give you an answer within half an hour. You can do them yourself, and you can take them home. You can do them for your work. So I have to do lateral flow tests twice a week as well myself. But more importantly, if those tests positive, we undertake swabs, the nasal swabs, and those are PCR tests. And what's really interesting about PCR tests, and there's different types, we can even tell from the PCR tests whether you're positive because you've had the virus or because you're positive because you've had the vaccine. And that's really interesting. So there are different types of tests for different reasons. And some are in research phase and some are very well established. The PCR tests for traveling, you need to look up each of your countries. And Raj, I'm going to ask you to help us about the country aspects of travel. Should we be traveling? What are the precautions we need to take?
So there are a lot of rules and regulations that the government is setting out, and they keep changing. And first of all, I would advise everyone to obey those. Please do not go against the rules. Secondly, even within the rules, if you're allowed to travel abroad to, Spain or Portugal, there's a huge temptation for all of us to take a break on the beach. Please resist that temptation. It's really not worth going abroad at this stage. We just don't know what is going to be happening at the country of destination where you're going, what's going to happen when you come back. This is a risk that's just too far to take. Stay at home. If you need be, have a staycation, but at socially distant manner.
Thank you. And Rajvi, then, somebody has mentioned that if you have the vaccine, you can get stuck to other people with magnet. It feels like you have a magnet in you. Is that true?
No, it's not true. So I did sort of mention it because it's one that's literally been circulating just in the last few days. So you have to just bear a few things in mind. First of all, the amount of a vaccine, because I actually administer COVID vaccines, as many of our panel do, it's like a tiny amount. It's basically less than a quarter of a teaspoon of liquid, and within that you have to suggest that there's something magnetic in there. I mean, think about how you would put a magnet on your fridge door, or how much metal is involved. So the quantity is tiny. Secondly, look at the ingredients list that is in a vaccine. Most of them are made up of things like sugar, water, a little bit of salt. There's such tiny amounts again of metal. I mean, it's sort of like you'd have to have that amount of metal in your food, and you don't see your magnet sticking to your food, do you? And lastly, right now, we don't know. When people show these videos, we don't know what they're using to stick on them. I mean, they could be using glue. They can be using a bit of water. We don't really know. And anyway, we all know how videos and photos can be manipulated. All these people are trying to say the vaccines are dangerous. Oh, look, there might be a microchip in it, which is a very, very old, it's from last year news story. I don't think people are going to buy it. You guys go ahead and try and just see, how easy it is to put a magnet on anything that is like on your body or inside. It's almost impossible. So please don't believe it. It's just another fantastical myth.
Thank you very much for that detailed explanation. Anuja Ben, there's a question here with regards to vaccine. What vaccine is recommended for newly married females and those with fertility issues, please?
Okay, so Amisha, as you know, anyone under the age of 40 should not be having the AstraZeneca vaccine because of the slightly increased relative risk of having the blood clots. So I'm guessing this newly married couple, they're probably under the age of 40. They should then be going for the mRNA vaccines, which is the Pfizer and the Moderna, or the Moderna vaccine. They are over the age of 40, any vaccine, and none of the vaccines have any effect on fertility.
So that's really important to note about the fertility issues. They do not have any effect. Perfect. Thank you. Abhay, when do you think we'll be able to travel to India safely? And then secondly, what can you do to help us prepare for a COVID third wave in general?
Abhay, you need to unmute yourself.
Sorry. So thank you for the question, Amisha. But I don't think traveling to India is going to be safe anytime soon. The reason for that is, things are changing very, very rapidly. Newer mutants are emerging. And as Raj mentioned earlier, traveling is a luxury. Unless it's really, really essential, avoid any kind of travel. You're not only putting yourself at risk, but you're also allowing more mutants to emerge by mixing different variants in different populations. Having said that, I actually am looking at the situation in India, and I think we need to look at it from two perspectives. For the current wave, we really need to get a very coherent communication message to stop the panic that is happening in India. There is so much of myth around remdesivir, steroids, mucormycosis. All we need to do is tell them to stop over-treating themselves, hold their hands. If we all collectively reach out to our families, our social groups, I think we can have a huge effect for the current wave. Now, what do we do for the next wave? And that is basically education. What we are doing today is talking about what is the right thing to do, what is the wrong thing to do. We need to do this at the grassroots level in India, not in English, not in medical terms, but in the village, in the local language, to hold their hands and say, yes. If they say, is this God's will? You tell them, yes, this is God's will. Because the simple people, they just will understand very simple language, nothing to confuse them. The second thing that I definitely am asking people to do in India is put their medical records together. A lot of deaths happen in India because the medical records were incomplete. They got admitted in the wrong hospitals, wrong treatments were given. I've seen people die of diabetic ketoacidosis when they only had mild COVID. Why? Because they got steroids. So I'm asking them, why did that patient die? He didn't have any high CRP. Oh no, his sugar was 1200. So this is all real. Medical records are very poorly managed globally. We have a luxury, we have a GP system. But in India, we don't have that. So I'll say, keep your medical records with you. And the third thing is start understanding home care. The concept that you don't need a doctor all the times. 90% of the times you don't need a doctor at all. You can self-heal. Human beings have been capable of healing themselves for centuries. If you have a fever, if you have a cold, if you feel unwell, the first thing to do is isolate. Talk to someone, make sure you have a pulse oximeter at home, and understand what is the social distancing, why isolate, why not go and show affection to someone who's got a cold. Those simple messages will stop the third wave. There is no magic needed. Vaccination, of course, to me is the biggest thing that will stop the third wave. But given our population challenge, and everyone will agree with me, that is a much trickier thing to achieve in India, especially with the disinformation, with the cost factor, and the fact that there are too many different companies now trying to give too many different kinds of vaccine in India. So we started with Covishield, then we have Covaxin, now we have Sinovac, now we go to Sputnik. And believe me, on a daily basis, I get at least 2 or 3 people asking me the questions we asked earlier. I had my first Covishield, can I now have a Sputnik?
Yeah,
There is no answer. No one really knows. So I'll say that, listen, again, hold hands. There will be some complications. Be prepared to say there will be some damage. We don't know the answers. We just genuinely don't know.
Just one small addition I'm going to just add to Abhay there is that we need to be doing a lot more research as well. India is a fundamentally amazing place that if we were able to do the research, we could do it so fast and get answers. And that's one of the things that the UK did.
Absolutely. But this is where I was going to add my last point. Don't think of ourselves as India, UK, US,
no, correct.
UAE. The pandemic has proven that there is only one boundary, human and non-human. So when you do your research now, don't apply for a grant for your or for your locality. Be bold. Put 20 other people together to say, you know what, we do not know the correct answer. I'll give you a simple example, vitamin D. And I promise you, no one knows the correct reference range for vitamin D. The data came out of Caucasian population. 97% of the population in UK actually shows some kind of vitamin D deficiency. That can't be right. How can 97% of Southeast Asians in UK actually be deficient? And the reason for that is we really need to start, literally the skin color, the race, the ethnicity. The virus proved one thing. It was blind to all those factors. It only understood, do you breathe and are you human? So I'll completely agree with you. And Raj and Amit, I look up to you two guys to say research you guys have to lead. We'll help you.
Thank you very much. And on that note, Rajbhai, I have a few questions for you. Are there any benefits in the use of 2 different vaccines instead of the same one twice? And following the pattern of flu vaccines, might we be having a top-up geared to new variants each year? I can repeat that one afterwards.
Yeah, so the first question, is there any benefit to having a separate second dose? There's no data on that. You got to remember, these vaccines have been approved via clinical trials. The clinical trial was done on 2 doses of the same vaccine by that company. So there's a huge amount of data showing if you have 2 shots of the same vaccine, that gives you very good protection. There is no data at the moment to show if you mix and match, either it gives you the same level of protection as you would get, or better or worse. So I would strongly advise, unless there's a specific reason, as Rimal said previously, do not take a different second dose. You will not be offered, and don't try and do that.
And then the second question was with regards to following the pattern of flu vaccines, might we be having a top-up geared to new variants each year?
Right. So we've got to be careful here. Flu vaccines are very different in terms of the way they're working against flu. Flu virus changes completely, radically between seasons. And that's why flu vaccine from last season is not effective against the flu variant of this season. That is not the case for coronavirus, right? When you talk about variants of coronavirus, all the vaccines are still effective. It's slightly less. So, having said that, just to make sure, as I said in my talk, there are different new versions of the vaccine being developed against these variants. So yes, if we find there are lots of breakthrough infections in UK, in the world, i.e. the vaccine somehow has lost all protection, then yes, that we may need so. But at the moment, it doesn't seem like they will need booster vaccination. But as I say, the pharmaceutical companies, the research group are all prepared for that, just in case we may need something like that.
Thank you very much. Rimal by next. I have a question with regards to A&E. How do you decide whether someone with COVID requires admission, and what advice do you give them to go home from A&E?
Brilliant. So in terms of how we decide if someone needs admission, it's basically looking at the patient, and predominantly it's about their oxygenation and what will they benefit from coming into hospital that they can't do at home, and that is predominantly needing oxygen. And so that will be done after their vital signs are taken, unless you're elderly and there's other reasons that you need admission for. For those patients that we send home, and this is relevant for everyone listening in India as well, it is essentially don't panic, stay at home, know the course of illness so you know what to expect, essentially, to keep hydrated, take paracetamol for fever as you need, and stay isolated, and make sure you're looking after yourself and those in your household, and keep your pulse oximeter on. And basically, if your pulse oximeter reading is lower than 94%, then you need to seek medical attention. Otherwise, it will pass and know that you will get better.
I might jump in there, Amisha, if that's okay with you, just to say, and exactly as Rimal has said, that remember that COVID virus can also cause non-lung related damage. So it can spontaneously cause clots in your heart arteries, in your brain arteries, in your stomach arteries, in your kidney arteries. So just bear that in mind, that there will be other reasons that COVID, you've had a cough and then a few days later you get a sudden chest pain, etc. So if it's not progressing as expected, things are not going down to normal after 7-8 days, etc., and something new comes along, please come to Casualty. We've got amazing blood tests, amazing scanning technologies, the imaging systems. They're really very powerful at knowing exactly. We can even tell you from a blood test if you have a superadded chest infection on top. And so those really help us. Rimal, would that be fair to say?
Absolutely. So COVID at the acute stage is what we're describing, but of course COVID can present in so many different ways, and looking at the non-respiratory sort of manifestations is absolutely important as well. So yeah, absolutely. Thanks, Ameet.
And I guess tying in with that, somebody has asked, how do you know when you should go to A&E if you suspect you have COVID? And you mentioned the 94% saturation. Is there anything else that they need to know?
Yeah, so obviously, if you're not entirely sure, then NHS 111 is the best place to ring, essentially, and they will go through it with you in terms of asking your symptoms. They'll even get a translator if you don't speak English, checking all your symptoms. They may get a clinician to speak to you and decide if you need to come to A&E. And what's really good about NHS 111 is they're now even giving you a specific time to come to A&E, so you may reduce the time that you need to wait. But predominantly, it is essentially about your low saturations, or if your heart rate's really high, or generally we say if you're not feeling well at all, and if you're sort of complaining of shortness of breath, you've got chest pain, or you're losing consciousness, those are the kind of real emergencies that we'd expect you to attend A&E or call 999 for.
Thank you. We have a few more questions. So Anuja Ben next. Can you tell us a little bit about what type of foods we should help to improve immunity? And I think Rajvi Ben, if you could help as well there. Thank you.
Healthy eating, which is I think something that all of us should actually be following, a Mediterranean style diet, which includes lots of fresh fruits and vegetables, lots of nuts, olives, green leafy vegetables, whole grains, beans, and ensure that you have enough vitamin D. I think all of this helps with our immunity. And having low, obviously keeping our saturated fats low.
Thank you very much. And Rajvi Ben, what is the best aid we can give to each other in the UK once the population is vaccinated? You're on mute, Rajvi Ben.
Sorry. Yes, for me, it's regular testing. Really, really important. As we start meeting up, as we start going out to restaurants, I had a gathering at my home yesterday. I asked everyone to do a lateral flow test before they came. It's free. You can order it from the government website. You'll get a pack of, I think, 6 or 7 delivered home. It just takes half an hour to do. It's so simple. It's really important that we stay vigilant and we keep on top of, as we start moving around and socializing, that we don't let it get to the point where we have to go to another lockdown. It is still the case that 1 in 3 people who have COVID are asymptomatic, and especially with the young people. So just do regular testing twice a week. If you're going somewhere on a cottage holiday over the summer with friends, ask everyone to take a lateral flow test before and after. And I think that will really, really help keep the spread down.
Yeah, Rajvi, can I just also, Misha, can I just add to that? There is a myth or there's a sort of perception that some of these tests are not working very well or they don't work, right? The lateral flow test, I've heard a number of my relatives saying, oh, it doesn't work. There's no point in doing that. They work very well. Yes, they may not be as accurate as the PCR test that we used to do, but they do work very well. That's not an excuse not to use those tests.
So the main message is to keep testing. Ameet, we have a few questions for you. Can you explain, I think in your talk you mentioned about fungus. So can you explain the black fungus and how it's affecting coronavirus patients, please?
Yes, so within our body live a number of organisms. We've got bacteria, we've got viruses, and we've also got fungi living alongside us. Now, these are really there in very small microscopic quantities normally. And we see them, we're attached to them, and we detach from them really quickly. And we're able, we have more bacteria on our body than our own cells. Imagine that. Now, what happens is that they are living in a particular harmony. When you destabilize that harmony with huge doses of antibiotics, get rid of bacteria. When you destabilize it by giving huge doses of antiretrovirals, get rid of viruses, what's left is the fungi. And the fungi that would normally just reside in your nose and not cause any problems or in your gut, actually we saw during HIV medications and HIV epidemic exactly the same problem. We were giving huge doses of these antibiotics, and guess what? Your own fungi that could actually be in the atmosphere around you, harmlessly living and coexisting with you, then get inside your lung and say, hey, we can party, there's nobody around, we can actually multiply, and they actually cause horrible fungal infections. And the treatment of fungal pneumonia is much harder, needs much more powerful medications that we're not used to. We haven't personalized those therapies to be absolutely specific. They still have really bad side effects because we haven't needed to develop that science since the HIV days. So you can get fungal infections, you'll get other infections of things that would not normally harm you, and they will turn into, the parasites will actually start winning and not in balance with you.
Which is why it is, as we said, Abhay said, Ameet said previously, which is why it is very important not to overtreat patients.
Absolutely. Absolutely right.
Thank you. I have an interesting one here for Rajvi Ben. I wanted to ask a question. Is Pimpalus a good substitute for cucumber? I'm not sure what Pimpalus is. It may be, is that related to?
I have no idea.
COVID? Okay.
No idea.
I just want.
Does anyone else know?
No, maybe it's not related to COVID then. I will leave that one out. Moving on, why, and this may go to Rimal Bhai and Abhay Bhai, why are COVID patients getting heart attacks? Actually, sorry, Ameet Bhai as well.
Problem. Actually, it's a really important thing. You've heard Rimal talk about vaccine-related clots. Well, actually, the virus itself causes huge amounts of clots. The virus is slowing down flow of blood through the lungs. It's actually clogging everything up. It's causing back pressure. And those same platelets that Rimal talked about normally healing you from cuts, actually as they slow down flow, they cause clumps. And those clumps can occur anywhere. We were seeing many patients who got through the ventilation stage. We got you off the ventilator after you've been sedentary for 10 days, lying on your front, horrible way to live, etc. It's no joy at all to anybody. But when we were mobilizing you, because the flow of blood had been so slow through your body, because you're inactive through your lungs, we're seeing these platelets clump and the clots are occurring. Now, currently, if you're in hospital, you will always get a blood thinner to prevent clots. unless you're at risk of bleeding. So we've minimized that risk at all times. But in the public, we're not giving people, clot busters if you're getting through COVID. So the message is stay mobile, stay hydrated, keep active, try and get yourself fit and back to normality as soon as you can past that COVID window so that you don't get these clots. Some people will be more genetically at risk of clots. And so be aware that if clots are a thing in your family or if you've had clots in the past. And again, the COVID vaccine that you should have if you have a history of clotting is, of course, not the AstraZeneca one, because the Moderna and the Pfizer have not been shown to have any increase in clots. They're favored for those patients.
Another question for Rajbhai. Are children going to be given COVID vaccines at any time, because schools in Harrow, Hillingdon, Hounslow are now testing in the area? Is that something that you've heard of or something that we need to consider?
I haven't heard of any specific plans for children being vaccinated, but the clear trajectory at the moment is that adults need to be vaccinated first. The reason is that there's still trials being done by vaccine on children. At the moment, as you can imagine, when COVID hit, the first trials you want to do is really the most vulnerable population, which were the elderly. They've then continued doing those trials on younger and younger people, and that's why now we know that COVID vaccines are safe for over 40s, for example, over 30s. And then, some of the vaccines like Pfizer has been shown to be safe for teens as well. But it hasn't been tested in children as yet in the same level. So we don't know enough so at the moment, it's still rolled out for adults, but at some point, if need be, and this is a key thing, that if we can keep on top of the pandemic, if we can keep, there's no new breakouts, there's no new lockdowns, then the children may not need to be vaccinated. We don't want to unnecessarily vaccinate children. However, if need be, there will be.
Thank you. Rajvi Ben, I have a question, and I know we've mentioned about going abroad, but should people be going abroad for holidays? As the government have said, things are opening up, so we can go to certain countries.
Thank you. Of course, it's everyone's choice. I mean, it's a choice because it's at the moment the government is allowing people to go abroad. Personally, I can't think of a worse thing to do right now. You will be in long queues. You will be in an enclosed environment with hundreds of other people on a plane at close proximity. There is no social distancing on a plane. They don't leave a gap between seats. You'll be right next to people on either side of you. And then if you come back, if you have to go into quarantine, quite often people are being put on buses or coaches to go to quarantine hotels. They may be put on buses with people from different flights coming from different countries. You don't know who they are, and then you have to quarantine in a hotel. I mean, I honestly don't think and it costs a lot of money. I mean, I hear it's something like £600 per person to get all the tests, and then if you have to quarantine, it's thousands. So I mean, of course, it's people's choice, but to my mind, it's like, why would you take the risk? And why right now there are huge areas of the world, like India is just one of them, where the pandemic is not in control. And travel was one of the ways it was spread the quickest in the first place. We mustn't forget that. And do we really want to go back there? So my advice is wait another year. Just, I don't know, go somewhere local if you can.
We'll keep our holidays to the UK for the time being. Anuja Ben, I have two questions with regards to long COVID. Who is more at risk of developing long COVID? And can you tell us more about long COVID? Do we have to wait for research, and how long could this take?
Okay, that's a really good question. Thanks, Amisha. So, unsurprisingly, those that have those that were really ill and in hospital, and particularly those who had long stay in hospital, are suffering from the effects of COVID longer. But having said that, we're seeing that fit and well women, particularly women who are in the middle age, around 40 to 60, are also suffering from long COVID. And these women often have had a very mild mild COVID illness to start off with. Also, those who have had a high BMI, so those who are overweight, are also at slightly more risk. Now, to tell you a little bit more about COVID, I'll say that I'm seeing a lot of some of my patients who are coming in with just symptoms which are unexplainable. You know, a little bit of fatigue, some breathlessness, and I've had to tease out from them whether they've had symptoms of COVID, you know, many months ago. Because if you remember, in the first wave, not everyone was tested. So if you had symptoms, even if they were mild symptoms of COVID, and if you're now having, you know, fatigue, breathlessness, you know, brain fog, all these things, maybe just go and speak to your GP. It might just be that, you know, you just want to rule it out. Um, Also about research, there's lots of research ongoing, and there is, as I said, the FOSS study, which is post-hospitalization study, and they're following patients for up to 25 years. So I'm sure we won't have to wait that long for the results, and you know, we'll find out you know, more as we go along. But from our past experience of other viruses and even bacteria, such as SARS and MERS and even Lyme disease, we know that these symptoms, they do get better. They can last a few days, sometimes weeks, sometimes a few months, you know, up to 5 months, but they do get better. So there is optimism there. But obviously, this is a new illness and we just have to wait and see.
Thank you very much for all of that information. I think we're rounding up our questions. I have the last question for Ameet Bhai. Can vaccines be compared with wearing a car seatbelt or a motorcycle helmet? For example, will we not get affected if you are not careful, but probably it will minimize the effect of COVID overall? So should we be taking these vaccines?
The risk-benefit equation of what we do for ourselves, what we do for our community, what we do for our loved ones, what we do for our healthcare system, all has to be taken into account. We as staff were the first to be vaccinated because not only did we want to protect ourselves, but we also wanted to be there to be able to help other people. Now, we saw that when the NHS staff started getting vaccinated, not only did they protect themselves, not only did they protect the people who are still waiting to get vaccinated in the NHS, but they started not carrying it and not spreading it to patients. So unless you want to live in isolation, then unfortunately, whether you want to or not, 95% of people will take the choice of having the vaccine. Now, there will be a small percentage of people who will worry unnecessarily, who will be futile and say, look, you're taking this choice away from me. I don't believe you should be able to do that. I'm going to make a protest. I'm not going to take the vaccine. Okay, we're going to follow up what happens to you. We're going to help you. We're going to make sure we understand, but it's not going to help anybody by you having that futile state. So 95% of people, thank goodness, will help us, will help their neighbour, will help the NHS, and that's where we need to be. The UK has secured 300 million doses of vaccine. That's what it's done. It's planned ahead, and look what we've achieved. We are through, we're talking more about going out, getting back to work, then we're talking about the deaths in ITU, all the things we've suffered. But we must not forget what these last 12 months have told us, that our behavior counts. Be responsible for yourself, but also be responsible for your neighbors and your community and your society. So we should be vaccinated. The impact, very clear, the vaccines work, 90% reduction of you coming to see us in hospital unnecessarily and reducing deaths.
Thank you very much, and thank you to all of the expert panelists for answering all the questions that have come through today. Before we finish today, I would like to hand over to Dr. Arvind Bhai Shah for the vote of thanks. Dr. Arvind Bhai Shah is a consultant paediatrician at North Middlesex University Hospital. He is the South Asian Strategic Lead for the Royal College of Paediatricians. He is the treasurer for the British Association of Physicians of Indian Origin, and he is an honorary senior lecturer at UCL. Dr. Arvind Bhai Shah.
Jai Jindra, and thank you very much, Amisha, for that kind introduction. And thank you for leading beautifully the panel discussion. And I learned so much because I'm a pediatrician, so there's a lot to learn. At outset, I would like to thank Ameet Bhai for his comprehensive talk on COVID-19 and very clear, important message. Do not turn your back. COVID is very much there. Raj Bhai's talk is very topical. We see that on the TV all the time, different kinds of COVID-19 variants. And the good message from his talk is current vaccines are effective. They are effective in preventing severe disease and hospitalization. So do stick to that. Anuja Ben's talk is beautiful about the long COVID issues, unexplained symptoms for more than 4 weeks. Do see a GP, especially have brain fog and things. And the management usually is healthy living, but if things are progressing, their health clinic you could refer to, and there they will do with holistic approach and other things. So do not panic. Rimal Bhai was brilliant in talking about what's the situation in A&E, and he is seeing 20% rise in A&E admission. They're buzzing, but buzzing with non-COVID patients. So the message is truly is you have unexplained symptoms, you're sitting on those, do seek opinion for GP. If you need to go to the hospital, hospitals are safe. So do attend hospital appointments. And also important message about the AstraZeneca vaccine, under 40, caution about that. Abhay, very brilliant talk about how he learned from the first wave as a surgeon, how they managed to get on with the second wave. But now we are running into problem with demand and capacity. Also his brilliant work with telemedicine and also tele-examination and helping our loved one back in India. That is brilliant. Also would like to thank you for Raju Ben for highlighting the myths and misconceptions about COVID-19. And I truly, oh God, 500 million WhatsApp users in India. So she gives really good warning about, remember that no forward and no fake news policy. Do adopt that and tell your friends about that. Again, thank you very much for all of our viewers who are given their Sunday evening to listen to the webinar. We would like to have their feedback. Of course, do respond to Ameet Bhai's survey. And also, I just want to reassure them that Jain Health Initiative will be there all along, holding your hand safely to take you through this difficult period of COVID-19. Now, as a pediatrician, I'm very sad that none of them have been talking about children. Let me touched about children. So may I request my viewers and colleagues, do write in your survey any particular area of children and young people you'd like to highlight, because they are our future. We want to get them on board. And I would also get them engaged with Jain Health Initiative. So without further ado, I'm going to now hand over to my phenomenal buddy, Ameet Bhai. He is a brilliant example of how to practice Jainism in day-to-day life. Not only, this is not my word, this is Varsha Ben's word. Thank you.
Thank you so much, Evan. But most importantly, thank you to the audience for joining us, and thank you to all my colleagues for coming through. I'm just going to reiterate, I'm really sorry, I'm going to reiterate our final component, which is please be informed, be prepared, be protected. Now, this is the most important thing. It isn't just World War XIX and COVID that this works for. It works for the entire world war of disease and health. It is our responsibility to be informed about our health, about diabetes, about cancer. It's our responsibility to be prepared for arthritis. It's our responsibility to avoid falls, avoid harm to ourselves. Take caution, take responsibility of this body, leave it in the best condition possible when you no longer need it. Be Jain all over to your neighbors and to your community. And with that calmness, you will absolutely help everybody. The final thing is just the survey. Your opinion really matters. We're health experts, we're community leaders, we're bringing these talks for our benefit to make an impact. We love doing what we're doing. We just want to be given a direction. Please complete the survey. Give us a few minutes back. Tell us if we're making a difference and tell us what we should be bringing you. We're going to take a short break over summer, but we've still got our cancer event, really important cancer event, some amazing speakers. Jyoti Ben Shah and colleagues will all be back. Rajvi, if you want to say anything more about the cancer event, please do, but it's going to be a fantastic pre-summer event, and that will be the last one temporarily before the summer, but we need your guidance. Your opinion really matters. With that, stay safe, be well. Thank you for coming. Thank you to Jane Health Initiative leaders and to the health team and the marketing, all the community leaders who've been kind enough to bring people to this event. Rajvi, tell us about the cancer event. Anything more that you want to tell us?
No, just to say it's on June the 13th at 8 p.m. So it's another Sunday evening, 3 weeks' time. Please tune in. We're going to be talking about the causes of cancer, the symptoms, early warning signs, the diagnostic tests, and the treatments, and more importantly, how to keep your risk factors down.
Perfect. And don't forget cancer research, Rajvi. Your great strength, of course. Brilliant. Thank you so much, all. Take it away. Bye, guys.
Bye. Thank you.
Bye.
Bye.